Welcome, Dr. Kishore. Welcome to our show, My Two Cents.
Thank you, Suhail. It's wonderful to be on the show. Thank you very much.
Dr. Kishore, a lot of information is available about you on public domain, about you and your work. But I want to ask you something very personal today. Why did you choose ENT and how did you develop your interest in cochlear implants?
Interesting question. I was influenced by my father. My father is an ENT surgeon. So I've been seeing ENT from the time since I was a child. And for whatever reason, the field of ENT and particularly the ear surgery and reconstructive ear surgery that he used to do always fascinated me. The little hearing bones of the ear and everything. So that's how I really developed an interest. And strangely enough, even before I got into medical school, I had decided in my mind that I want to be an ENT surgeon. It's a crazy thought, but that's the way it happened. When he was practicing, and I was in medical school in the late 80s and early 90s, he told me of this new technology called cochlear implants that would restore hearing in children and adults who were severely hearing impaired. And that was fascinating, groundbreaking as far as I was concerned. And again, at that time, I decided that I'm going to try and learn this technology and bring it to our people.
Wow. So Dr. Kishore, today we'll pick up a topic which is close to the heart of many ENT surgeons. So there are a lot of ENT surgeons out there who want to start a cochlear implant program, or if they've already started, they're struggling to run it successfully. So what are your 2 cents for these surgeons to start and run a successful cochlear implant program?
Brilliant question, Suhail. I think the gist of this is that a cochlear implant program, like you said, is a program. It's not purely a surgical option. I've been trained and involved with cochlear implant programs from my time in the UK from the early 90s. So that's over 25 years. And what I've learned and what I continue to practice and continue to teach is that the treatment of hearing impairment through cochlear implant has to be a team approach. That is the first and foremost thing. And I'm very fortunate. We are fortunate that we at Adventis for the last 15 years or so have our audiology and habilitation team of Sphere Speech and Hearing Clinics. And together we are able to run a program, as you said. And the second thing that we need to keep in mind is that we have to be focused on outcomes, on results. It's not about doing a few operations or treating X number of children or adults. So if we have these 2 things in mind, my 2 cents to all the upcoming and budding ENT surgeons who wish to embark or have embarked on this process is that keep in mind that you have to have a very dedicated team of surgeons, audiologists, habilitationists, maybe electrophysiology, psychology, input from radiology and pediatricians and physicians and neurologists. You have to focus on outcomes, and that way you have to ensure that every child or every adult is critically assessed on every aspect, and that's the hearing aspect, and the speech and the imaging, and of course the surgical nuances. We as surgeons have to hone in on our surgical skills. If we put these things together and look at this as a program which is going to run over a period of time, and this is not a short-term thing, Yeah. I've been involved in cochlear implants for 25 years. I've been here in India now for over 15 years. Yes, we have a cohort of cochlear implant recipients of over 2,000, right from an 8-month-old to an 80-year-old. Oh. So we have a very large program, but that's not come overnight. It's happened because of dedicated team approach of our surgical team, along with Sphere Speech and Hearing Clinic audiology habilitation team, a concerted, dedicated team approach. Once you deliver the outcomes, once you ensure that your clients, your patients, your cochlear implant recipients get the best of care, and you can show those outcomes, the work will come automatically. And you have to maintain that. That's very, very important. So I think these are the key fundamental principles. You have to be very patient, and you have to be willing to learn, willing to discuss. You'll always have difficult situations. So, senior and experienced mentors are always there to guide the less experienced and upcoming clinicians. So don't hesitate to reach out, is what I would say.
Great. That was a great answer. I'm sure all the surgeons out there must have taken your 2 cents very seriously. Thanks a lot.
Thank you, Sohail. It's been a pleasure to be on your show.